Welcome to Spec Yourself's Thursday night webinar program. We bring you Exercise and the Immune Response, a functional perspective presented by Danielle LaFata. Slides and other educational materials are in the resource box on the left of your screen. You may submit questions in the Q&A box, and if time permits, we will answer these at the end of the presentation. At this time, I would like to welcome back Danielle LaFata.
Thank you, Jessica. Thanks so much for joining me today. I'm excited to talk about this topic, exercise and the immune response, a functional perspective. I do want to say it's definitely broad strokes global overview of talking about these two things together. So our learning objectives, real quick, I won't read them all, but we're going to discuss the relationship between exercise and the immune function, look at how overtraining in the world of an athlete can parallel with chronic fatigue syndrome, and also the role the immunodex plays in determining our immune response. Okay, so, immunity is our body, as you guys all know, it's our body's ability to defend against infection and disease. We have a variety of cells, tissues, and molecules that compose the immune system to fight off pathogens, viruses, parasites, and bacteria. And we know that the immune system is divided into two main categories, right? We have our innate immune system over here on my left-hand side of the screen. This is the system that we are born with. And then over here on the right, on my right-hand side of the screen, we have our adaptive or acquired immune system. As you guys all know, it's what we've developed over time. So as we can see in this diagram, there can also be overlap between these systems. So to go a little bit in depth, like again, further review, I should say, the innate system, remember, involves our phagocytes, natural killer cells, macrophages, among other cells. And the innate immune system responds fairly quickly to a breach, but lacks that specificity or the same response to all the challenges. So the innate immune system is our body's first line of defense against germs entering the body, and it responds in the same way to all foreign invaders or substances, which is why it's sometimes referred to as the non-specific immune system. So as a first line of defense, right, it's those physical barriers such as our skin and the chemical barriers such as mucus or stomach acid, among other compounds. Then we have our second line of defense, right? That consists of our non-specific immune cells, such as the macrophages and our dendritic cells. And then our third line of defense is our adaptive or the acquired immune system, which we're going to focus on today. So this system includes cells that have antigen, specificity, and memory properties. So it will take much longer to develop on an initial exposure to that foreign invader. However, the speed and magnitude of this response will increase with subsequent exposure. And this arm of the immune system is what is made up of our lymphocells, like the lymphocytes, like our T cells and our B cells, which are also activated by dendritic cells. All right, so then to further break down our acquired or adaptive immune system, we have our humoral immune system, which is our antibody. They produce this part of the immune system produces antibody. And then over here on my right-hand side is our cell-mediated immunity. So we can look at cell-mediated immune function that does not involve antibodies, but the activation of our macrophages and our natural killer cells by our T lymphocytes. So, and then the release of various cytokines in response to that antigen or foreign invader. So this essentially is the process by which our T lymphocytes or our T cells protect the body from damage, signaling nearby cells to respond to that specific biological threat in the body from damage. So this cell-mediated immune response typically precedes the antibody response. So it's nearly first. In a way, this is the first line of defense in this particular system. Evidence suggests that in some cases, an effective cell-mediated immune response can effectively eliminate a pathogen even before detectable antibodies are manufactured. So then to take this further, talking about those cells that are in this adaptive immune response or cell-mediated immune response are lymphocytes. So as you guys all remember, they start out as stem cells in our bone marrow. The ones that stay in the bone marrow are called B lymphocytes. Now, fun fact, as I was getting, kind of getting through all this, and I was learning some new things that I did not know before, and I learned that the B for B lymphocyte is actually named after an organ only found in birds where they were first discovered in 1994, and that organ is called the bursa of Fabricius. But it works here as these cells that remain are in the bone marrow, so B lymphocytes. Okay. Anyway, so these B cells in the bone marrow are important for our antibody production within that humoral immune system, right? The antibody side of the adaptive immune system. Now, the lymphocytes, remember, that leave the bone marrow, they travel to the thymus, that organ that's located in our chest where they mature and become our T cells or our T lymphocytes. So, and these cells don't secrete antibodies like our B cells. So instead, they're known for that cell-mediated response to a foreign invader. So as we discussed in the previous slide, that cell-mediated response is the activation of other cells such as our phagocytes and antigen-specific T lymphocytes or cytotoxic T lymphocytes, along with the release of various cytokines in response to that antigen. So essentially, very simply, the B cells attack the invaders outside of the cell, and when the cells become infected, the T lymphocytes come into play. So our T cells or T lymphocytes generate these various helper cells or TH cells to take care of invaders. So in other words, our cellular immunity occurs inside infected cells and is mediated by our T lymphocytes, where they signal nearby cells to respond to these threats versus utilizing antibodies to take care of the threat. So since SpectraCell uses the T lymphocyte to determine their micronutrient, to do their micronutrient analysis, as well as get that analyte, our Immunidex, we are going to focus on this side, and also for time's sake, we're going to focus on this side of the immune system and exercise most specifically. All right, so what weakens our immune system? As we all know, chronic stress. And for those of you that have been in consults with me, right, and those of you even if not, we all know that chronic stress, the body doesn't recognize what type of stress. It just knows that it's stress. So we've got environmental, psychological, physical, structural, and you guys know, and you see that a lot with your very active, physically active individuals and clients. Their Immunidex will be taxed, their SpectraCell, a lot of their B vitamins, their glutathione, CoQ10. So a lot of that physical stress, if they're not incorporating their rest days, you guys see this in the micronutrient tests. We also know that poor gut health is going to weaken our immune system, right? 70 to 80% of our immunity is in the gut. And then, of course, poor diet, whether it's eating a standard American diet. If we get into, the athletes who are skipping meals, or just in general population, we're missing meals, we're missing those opportunities for feeding. And so then we're going to get into those micronutrient deficiencies and so on and so forth. So I thought I'd come in here and talk about physical activity guidelines, right? So these next couple slides, we're going to talk about, all right, well, what constitutes moderate activity versus vigorous, intense activity? So starting with ACSM, their physical activity guidelines are based on what we would consider moderate activity. So less than an hour in one time period, and a rate of perceived exertion scale of 1 to 10, again, to keep it just very simplistic, 1 being a walk in the park, and 10 being to exhaustion or that vigorous, right? You're going to fall over or pass out. Moderate, we're looking at that RPE or rate of perceived exertion at about a 5, 6, 7, okay? So then they're saying that 150 minutes to 300 minutes a week, or vigorous intensity aerobic activity at 75 minutes, or a combo of the two. And then, of course, additional health benefits are gained, and this is, of course, aerobic exercise. And then, of course, they're stating that additional health benefits are gained by engaging in physical activity beyond that of 300 minutes, again, keeping it to the moderate less than an hour at a time, as well as doing some muscle strength training, or that muscle strength training, strengthening activity like strength training that involve all of our major muscle groups on 2 or more days a week. Now, vigorous and high intensity exercise. So it's exercise a long duration. So either, some studies are saying about an hour and a half. Some are going as far as over 2 hours. So let's just say, over an hour and a half of physical activity, and or intensity. So greater than 80% of maximum oxygen consumption, or that VO2 max. So again, right on that rate of perceived exertion scale, 1 to 10, 8, 9, 10 being vigorous activity. So now one of the earliest studies, I found this, it was 86, they looked at exercise and immune function and saw that when exercise was strenuous, that 80% or greater of VO2 max and longer than an hour and a half, they found that the number of circulating lymphocytes decreased below pre-exercise level for several hours after exercise, and that lymphocyte ratio also decreased. And this ratio is important as when it's reduced, it's associated with a reduced resistance to infection. So although more research is needed to confirm this response, this seems to be the way we're trending when I was looking through all the reviews and all the studies. So then in a review by Nyman and Wentz in 2019, they found that an acute bout of moderate to intense aerobic exercise of less than 60 minutes or an hour enhanced recirculation of our immunoglobulins, our anti-inflammatory cytokines, neutrophils, natural killer cells, our cytotoxic T cells, they're a type of T lymphocyte, all of which play a critical role in our immune defense and activity on our metabolic health. They also found that moderate exercise creates small and acute elevations in our interleukin-6 that exerts direct anti-inflammatory effects. And so this is not the cytokine interleukin-6, this is the myokine coming from the muscle. So interleukin-6, right, it can be pro-inflammatory as a cytokine and anti-inflammatory as a mitokine. So, and then in another review that I found, it was found that both human and animal models with exercise of long duration or that vigorous intensity was associated with markers of immunosuppression, such as increased production of our pro-inflammatory cytokines, an increase in, this one looked at lower respiratory tract infections, we'll talk about URTI in a bit, a reduced activity of our natural killer cells, reduced activity of our T and our B lymphocytes as well as our neutrophils, as well as reduced production of salivary IgA and our plasma immunoglobulins M and G. Okay. So when speaking of, competitive athletes, right, when we're getting into team sports or, even our general population that's getting into marathons, ultra marathoners, Ironmans, we can't forget about the other stressors, not just physical activity, that these types of events or sport bring. So we have to think about, right, we know about the high training loads, we've been talking about that, but what about the competition day, right, the week or the night before or the day of? That's an additional stress. Traveling. I was with the U.S. men's national soccer team for 3 years. Every month we were gone for 2 weeks, and within those 2 weeks we traveled to 2 or 3 different cities, or actually countries, and even from country to country when we were overseas. So that, as you all know, that traveling stress, it adds another element to maintaining our immune system and helping with that recovery. And so evidence does support that high exercise training workloads, competitive events, and other associated stressors are linked to immune system dysfunction, inflammation, oxidative stress, and muscle damage. Illness risk may increase when an athlete competes, goes through repeated cycles of unusually high exertion, and experiences other stressors to the immune system. The International Olympic Committee found through some studies that they've done, in 2 to 18% of elite athletes, they experienced illness episodes. And there was a higher proportion of these episodes in the female and endurance athletes. Other findings were that natural killer cells and neutrophil function, various measures of our T and B cell function, as well as salivary IgA and other markers were found to be altered for several hours up to days during the recovery from this prolonged, intense endurance exercise. And even more so, some other studies found that overexercising emerges to negatively affect immunity. Most research confirms that the model of effect of exercise on the immune function in greater than 90 minutes of high-intensity exercise, again, that rate of perceived exertion of 8 and above, makes a person more susceptible to illness for up to 72 hours after completion of that physical activity. So, as we all know, that during prolonged high-intensity exercise, the body produces the hormones cortisol and adrenaline, which raise blood pressure, elevate cholesterol, and then also suppress the immune system. So then we have some, neurotransmitters and hormones, coming into this, as well as our immune system. So we have a lot of things that are happening with exercise, right, and recovery. Now, in the same review paper that I mentioned a little bit ago with Nyman and Wentz, they looked at 4 epidemiological studies and 5 randomized controlled trials on the relationship between moderate exercise and illness risk, and they concluded that the randomized clinical trials that lasted 8 weeks to 1 year were consistent in demonstrating that study participants assigned to moderate exercise programs experienced reduced upper respiratory tract infections, or URTI, incidence and duration. The epidemiological studies they reviewed showed reduced URTI rates in high versus low physical activity and fitness groups, and they also found that exercise can promote the recirculation of key immune cells and mediate the anti-inflammatory and antioxidant state through multiple mechanisms. So at the end of the day, over-exercising shows to negatively affect our immune system, right? And most research is confirming this model, this J-shaped model of exercise on immune function in that duration of over 90 minutes. And a person is more susceptible to illness for up to 72 hours after completion of that physical activity. So when we're talking about this and getting into those sports, the team sports, the ultramarathon, the Ironman training, we can, and we're trying to define or look at when is somebody getting into that period of a depressed or suppressed immune system. So we're trying to define the different ways we can look at overtraining or how we get there, right? So there's still not, the consensus seems to be becoming a little bit more, there is becoming more of a consensus on these definitions. So for the purpose of this talk and time's sake, we'll just say that overreaching is that accumulation of training and or non-training stress resulting in short-term decrements in performance capacity with or without related physiological and psychological signs and symptoms of maladaptation, in which restoration of performance capacity may take from several days to several weeks. Okay, now we're looking at overtraining as the consensus on this definition is an accumulation of training and or non-training stress resulting in long-term decrements in performance capacity with or without related physiological and psychological signs and symptoms of maladaptation, in which restoration of performance capacity may take several weeks to several months. Now, overtraining syndrome now reflects the body's inability to adapt to cumulative fatigue resulting from intense exercise training that is not balanced with appropriate and sufficient rest. So in other words, it can occur when a person exceeds their body's ability to recover from the strenuous exercise, right? So overtraining can be described as a point where a person may have a decrease in performance and plateau as a result of a failure to consistently perform at a certain level or training load. So people who are overtrained, they cease to make training progress and can even begin to see loss of performance and as well as strength. You know, overtraining is also known as chronic fatigue, burnout, and overstress in athletes. And it suggested that there are different variations of overtraining. So we could get into maybe a monotonous program where we don't have those undulating training series, and it's to suggest that a consistent repetition or the same movement, such as weightlifting or baseball batting, it can cause a performance plateau due to an adaptation of the central nervous system. Another way of looking at overtraining would be described as chronic overwork, where the subject or the athlete may be training with too high of an intensity or volume and not allowing sufficient recovery or time for the body to heal. And again, we all know that with certain clients. I've had some clients where they do a lot of HIIT training, 6 days a week, 7 days a week, or they start getting into running and they do it 6-7 days a week, and there's no recovery period. There are no downtime. There are no down days. So there are many suggested signs and symptoms of overtraining syndrome, but there is also a lack of validation on these suggested signs and symptoms. So, however, identifying, right, as we all know, clear symptoms are important. So we need them from a practical viewpoint, and athletes and coaches wish to identify as early as possible that athlete moving into that overtraining syndrome so that training can be altered before the performance gets that deterioration standpoint. Number two, from a scientific viewpoint, clearly identifying the symptoms of overtraining syndrome will give us direction to the search for that underlying mechanism, and then how to correct, how to look for it and how to correct it. So again, these variables are, listed here. It's not an exhaustive list, but, we're looking at loss of strength and fitness and overtraining. We'll start to see that low energy and overreaching. And you guys can read these here on the screen, so I won't read them off and go through them. All right. So then, I thought about chronic fatigue syndrome, and I thought I would briefly pull this in, as some studies have shown a link between the two, overtraining syndrome and chronic fatigue syndrome, most specifically due to increases in oxidative stress and free radicals, among some other signs and symptoms, which I've pulled out on the next slide here. And some studies have shown that chronic fatigue syndrome can be said to represent the extreme end of the overtraining training syndrome continuum. So what do we know? So you guys all know that chronic fatigue syndrome is a debilitating disorder, which is characterized by intense fatigue that's not improved with rest and can be worsened by physical and mental stress. Also, strong exercise-induced production of free radicals are found in chronic fatigue patients. There's also significant dysregulation of the immune system function, and specifically through an increase in our pro-inflammatory T lymphocyte cytokines. Interesting enough, when looking at this, there were a few studies that looked at well-trained athletes over a short-term period of 2 weeks, restricting fruit and vegetable intake. So, as you know, low antioxidant diet. So keeping those to 1 to 2 servings a day. And this restriction, as you can all imagine, resulted in increased oxidative stress, increased rate of perceived exertion on an exercise that they would normally say was a low or moderate exertion activity, and an increase in inflammation. But there was no change in performance in these studies, but again, it was only for 2 weeks. So again, they were probably getting more to that overreaching, overtraining, and not necessarily OTS. So here on this slide, symptomatically, OTS and chronic fatigue syndrome appear almost identical, with very similar symptoms such as fatigue, pain, post-exertional malaise, sleep issues, cognitive problems. Most research is alluding, though, to the fact that recovery from overtraining can take several months, maybe even years, depending on the person. And also to note is that overtraining syndrome and chronic fatigue syndrome can affect activities of daily living. So in all, again, I thought I'd pull in this comparison. as I believe that our treatment, most specifically work around mitigating oxidative stress, can benefit both of these syndromes, essentially, therefore helping our patients, improve their overall health and vitality. Okay, so then looking at that, right, you guys all know these wheels that we can find on the website. So it's not very clear here, but I kind of circled, we see, a lot of parallels between the nutrients that can affect fatigue as well as the nutrients that are important in sports nutrition. And then that leads us into looking at the immune system and sports nutrition nutrients. So here, because we don't have a wheel yet, unfortunately, on the immune system, so I pulled this one together. Again, this isn't an exhaustive list, but pretty much when we're looking at the immune system, whether from just general overall health or helping, with our active individuals and our athletes, we want to look at the B vitamins, we want to look at glutathione and cysteine, selenium and vitamin E, and we're going to talk about a few of these on the next slide, as well as how these all relate to the immunodex in our immune system. So if we look here, but our immune and sports nutrition nutrients, again, not an exhaustive list. We saw that their B vitamins were also on there. I don't have selenium on here. But again, for time's sake, we're just going to touch on a couple of these. Okay, so we all know, vitamin C's role in our immune system. It stimulates production, function, and movement of our white blood cells, most specifically the neutrophils. What we're looking for on the micronutrient test and the immunodex are lymphocytes and then also the phagocytes. We know that it increases serum levels of complement proteins. It has roles in antimicrobial and natural killer cell activities. Then it also promotes collagen synthesis, supporting the integrity of the gut epithelial lining, and regenerating, also important for regenerating other important antioxidants, such as glutathione and vitamin E. It's deficiency, as you guys all know, just a little review here, it increases, oxidative damage is going to be increased. We can also expect an increased incidence and severity of pneumonia as well as other infections. We will have a decreased resistance to infections and cancer, decreased and delayed type hypersensitivity responses, and of course, poor wound healing. In the literature on vitamin C and active individuals or athletes, we can see that increased vitamin C consumption has been shown to reduce the susceptibility of URTI, upper respiratory tract infections, in endurance athletes. Other studies have shown that increased vitamin C supplementation positively influences the immune status of recreational athletes, and this has been proven by evaluating the response of neutrophils and lymphocytes during vigorous physical activity. Additionally, during a period of strenuous exercise, researchers have noted positive immune function improvements with athletes who increase their vitamin C intake. So we can't have an immune discussion, right, without vitamin D, especially with all that is going on with COVID. The same thing with vitamin C and zinc and some of these other nutrients we're going to talk about. So, although, dosing amounts are still controversial, it is, you're right, we're starting to see that there is some consensus that sufficient serum vitamin D levels are important, and it's becoming more widely acknowledged that we need to keep an eye on this nutrient, as research is showing that it's critical for a healthy immune response for both viral and bacterial infections, and it's been shown to decrease inflammation, thereby promoting the best immune function, and it has been shown to protect against, respiratory tract infections, as you all know. Again, just a little early review on vitamin D. Early studies investigating the effects of this vitamin D on the cells of the adaptive immune system have demonstrated an expression of the vitamin D receptor, as well as vitamin D activating enzymes in both our T and B lymphocytes. Also within the T lymphocytes, there is an upregulation of vitamin D receptor expression, significantly allowing regulation of up to 500 vitamin D responsive genes which influence differentiation and proliferation of these cells. It's also been recently found that vitamin D can inhibit differentiation, proliferation, initiation of apoptosis, and decrease immunoglobulin production, both in T helper cells and the B cells. It's also been found to inhibit the secretion of our pro-inflammatory TH or T helper cell 1 cytokines. So a lot with vitamin D on making sure that, lots of importance on making sure we're dosing appropriately and making sure that we are looking at our intracellular levels, right? So again, I'm not spending a lot of time here, and this is just a review, but just to note that also with vitamin D deficiency, as you guys again know, research is showing that the D deficiency can increase our susceptibility to infections, especially URTI, and an increase in morbidity and mortality with deficiency, along with an increase in severity of infections, reduced number of lymphocytes, again the immunodex, reduced lymphoid organ weight, and an increased risk of autoimmune diseases, as we all know, like type 1, MS, lupus, and so forth. All right, now we have vitamin E, right? Another great antioxidant. It's, as we all know, it's a fat-soluble antioxidant, most specifically important for the protection of lipid peroxidation, protecting the integrity of that cellular membrane from damage that's caused by free radicals. It also plays a role in our adaptive immune system by enhancing our T lymphocyte-mediated functions, as well as lymphocyte proliferation, specifically enhancing a specific cytokine, interleukin-2 production, and our natural killer cell activity. And it plays a key role in protecting the thymus gland, right, where our T lymphocytes are generated, as well as all of our white blood cells from oxidative damage, and helps to manage inflammation. Although deficiency is rare in humans, when deficient, it's been shown to impair both humoral and antibody-specific immune function, as well as that cell-mediated immune function of our adaptive immune system. Again, right, our T lymphocytes. So with zinc, again, another nutrient we all know too well. It's considered to be a constituent of enzymes that readily assist in the digestive process. Again, it's an essential trace element that constitutes many of the enzymes required for normal metabolism. Supplementation has even been seen up to 100 milligrams, which has been shown to reduce various colds and symptoms, helping to limit upper respiratory tract infections. Some studies, supplementation has been shown to enhance the immune status of hospitalized elderly and liver plasticity of an aging population. Again, still more extensive research, they always say, is needed. In terms of athletes involved with intense exercise, protocols have been shown to demonstrate zinc deficiencies, so it would be beneficial to employ a zinc replenishment or therapeutic replenishment status to, enhance that immune system of our athletes and our active individuals. As for its role in the immune system, right, it supports the body's natural defense system. We all know that it's a huge antioxidant, helping to make glutathione, as well as a role in superoxide dismutase antioxidant system. It helps to modulate cytokine release from our T lymphocytes, has a central role in cellular growth and differentiation of our immune cells. It's essential for intracellular binding of the tyrosine kinase to the T cell receptors, again, required for T lymphocyte development, and many, many, many more functions with zinc. As we all know, with the deficiency, we're going to see a decreased lymphocyte number and function, particularly the T cells, increased thymic atrophy, also altered cytokine production that contributes to oxidative stress and inflammation. Also with the deficiency, we'll see increased bacterial, viral, and fungal infections, particularly diarrhea and pneumonia, and also, again, decreased, and I already said that, thymic atrophy and consequence of risk infection. So glutathione, our master antioxidant, right? So we know that it's primarily synthesized in the liver and transported to tissues via circulation. It's a major endogenous antioxidant throughout the body with high electron donating capacity. Therefore, it's critical for mopping up free radicals and reducing oxidative stress when we're sick, and has been shown to inhibit viral replication. It's also been shown to prevent the process of oxidative stress through the removal of our free radicals. Some studies have shown that the cytotoxicity or killing of the cell and free radical generation are reversed by glutathione. And then also, right, we know that it helps to recycle our vitamins E and C, and then they do the same as I mentioned earlier. Nutrients to support glutathione. I'm on the, Dr. Grabowski's school of thought. I always like to make sure that my building blocks are there, right? So we want to look at everything that helps to make it, protect it, and recycle it. So I always start there when I'm looking for my glutathione support. So we know that B2 helps to convert cysteine into glutathione. Glutamine and cysteine are two of the three amino acids important for glutathione, cysteine being the rate-limiting amino acid. Selenium, extremely important in the glutathione peroxidases, right, the enzymes, important in the glutathione system. Again, vitamin C and E regenerating glutathione, zinc and magnesium as cofactors for this particular nutrient. So really helping to get the foundation solid and straight, and then utilizing glutathione. Also, too, from I used to work with athletes, and Max GL used to be a huge product back in the day, and it was glutathione, and I'd run SpectraCell on these athletes, and their glutathione would be through the roof, and almost all or at least half of these nutrients would be pushed down. They'd be at borderline or lower. So that's why I always like to get the building blocks and help that before I go after the glutathione. Glutamine, right? It's one of the most abundant conditional amino acids in the body, which has been shown to be vital metabolic fuel during exercise for a variety of components of the immune system. It also plays an important role in the enhancement of protein and glycogen synthesis. This is specifically evident with lymphocyte function because below normal glutamine levels following intense exercise over long periods of time have been shown to contribute to immune suppression in overtrained athletes and the general population. The reduction of blood glutamine levels from intense prolonged training can last up to 6 hours after training, which is why some believe that it's imperative to replace the glutamine levels before, during, and or after training in order to enhance recovery and reduce the probability of reaching that overtraining syndrome or phenomena. Individuals with chronically low glutamine levels make it more difficult for the body to respond to attacks on the immune system. In addition to the benefits associated with immune function, glutamine has been shown to enhance, I said that one already, as well as optimize cell hydration. These findings indicate that supplementing 6 to 10 grams of glutamine before and after exercise promotes muscle mass and strength improvement. Still, though, more research and data is needed in terms of glutamine supplementation because it suggests that there's a viable alternative for reducing markers of overtraining and enhancing the immune function and helping improve that strength training components. But the research is still, as we're talking about all these great things, we're still not able to see it clearly. It's still about 50-50 on when it comes into play, and it seems to help, and then some studies are still not there yet. Also, too, though, consuming a high-protein, low-carb diet for several days prior to exercise has been shown to result in a lower plasma glutamine concentration. And glutamine supplements, though, have received little support from well-controlled scientific studies. So this is where we're kind of, although I've used it and I will still to this day use it with my athletes. I've been using it for 12 years. Again, we do many other things, so it's hard to weed out the variables on exactly what all is working, but definitely I found it to be helpful with mitigating overtraining and helping with recovery. Other considerations with glutamine, prolonged intense exercise can negatively affect neurotransmitter homeostasis and immune response when glutamine levels are depleted. So in order to detoxify ammonia in the brain, causing a more excitatory glutamate-driven response to exercise-induced stress and a decline in that GABA-mediated inhibitor pathway. It is important to note that depleted serum glutamine levels mean less uptake in the intestines, right? So we know leaving the enterocytes more susceptible to intestinal permeability and that transient dysbiosis that we see post-exercise in some of our athletes. And again, as you guys all know, right, glutamine is that major or the main antioxidants for the integrity of our tight junctions. All right, so again, looking at our micronutrient report, right, our immune system nutrients, we've covered glutathione. Cysteine can come in there as that precursor to glutathione, you know, selenium and vitamin E, and then they also play a role in exercise and that physical activity health. The B vitamins, looking at that stress, even we could even pull from an exercise standpoint. I have another slide on that here in just a second, right? But we can look at pantothenate coming in here as well, as we see in even 80–90% of our general population, even our non-exercising clients, that the stress that we're just all under in general and how that can have a profound effect on our immune system and affect that immunidex. So let's review the immunidex, right? What does it measure? So as we discussed, our T lymphocytes are the key player of that cell-mediated immune response and play a role in how well our immune system can handle oxidative stress via intense exercise, among other things. They protect us by telling other cells what to do, as we discussed earlier. Since T cells must physically contact an infected cell in order to destroy it, they're said to provide that cell-mediated immunity, as we discussed earlier. So to note that SpectraCell has been measuring the cell-mediated immune function on T lymphocytes since the early 90s with this Immunidex test. So basically, the Immunidex quantifies that cell-mediated response to our cell-mediated immune response. It's one measurement, right? There are many other things we can look at, but it is one measurement to evaluate a person's cell-mediated immune system performance produced by the direct action of those T lymphocytes versus our antibodies. So specifically, it measures T lymphocyte proliferation. So since immune function is a systemic measure of general health, a higher Immunidex score is generally desired since it means a person can respond more efficiently not only to outside or exogenous threats such as pathogens or allergens, but also to our endogenous threats such as tumors. For example, the immune system, as we discussed earlier, remember that it is comprised of both Th1 and Th2 components, right? T helper cell 1 and T helper cell 2. T helper cell 2 go between the two humoral or antibody system and cell-mediated system. And when balanced and performing optimally, it can afford us a critical protection to help promote our health and wellness. So to get the Immunidex, right, well, this is our lymphocytes. They're isolated from our whole blood, and then they're introduced to a protein that stimulates growth, right, the mitogen, the activator. So this protein, mitogen, used to trigger mitosis or cell division, stimulates the T lymphocytes to proliferate. The proliferative response is measured by the incorporation of radioactive thymidine into newly synthesized DNA. The patient's response is compared to responses of a reference population, and the results are reported as our Immunodex score. So what affects our Immunodex results? Well, micronutrient deficiencies will, as we all know, right, undermine a person's immune function and thus lower the Immunodex. Since the highly complex immune system is dependent upon the intracellular availability of our vitamins, our minerals, our antioxidants, our specific amino acids, and other corresponding deficiencies, typically raises the Immunodex and contributes to tangible clinical benefits such as reduced infections, and may assist in achieving that immune system balance, or that ratio of our T helper cells, or CD4 to CD8 balance. So again, remember our Th1 or our T helper cells are a lineage of this CD4 effector T cell that promotes cell-mediated immune responses and are required for host defense against our intracellular viral and bacterial pathogens. So our Th1 helper cells will secrete mostly interferon gamma, interleukin 2, interleukin 10, and then Th2, or T helper cell 2, are involved in our type 2 immune responses, which are important for eradication of extracellular parasites and or bacterial infections. And the T helper cell 2 line will produce the cytokines interleukins 4, interleukins 5, 10, and 13, which are all important for the induction and development of that humoral immune response, or the antibody response. So how does the Immunodex correlate with antioxidant function? So in general, the higher the antioxidant score, right, our Spectrox, the higher the Immunodex score. So antioxidant function plays an important role in promoting optimal T cell function. It is important to find out if one of our clients has deficiencies in specific antioxidant nutrients so that we can supplement wisely, right, as well as show them why we need to incorporate these rest days, why we need to get in the fruits and vegetables, the polyphenols, the antioxidants, and get that color on our plate. But it's also important to measure that total antioxidant function because the metabolic pathways in which antioxidants are involved are highly complex, sometimes redundant, and even overlapping. So research is confirming that taking excess antioxidants that are not needed, where no deficiency exists, for instance, can actually cause them to become pro-oxidants and decrease our antioxidant function. So again, you guys remember, as we look at all this, 90% of the time, these two analytes, right, they go hand in hand. If we see a poor Spectrox, we're going to see a poor Immunodex. And because those antioxidants, when we have that Spectrox, right, more free radicals, and we do have antioxidants, that oxidative stress and inflammation is going then to bleed into our immune system health and that balance between our lymphocyte ratio. So again, right, bringing it all together, we want to support the immune system. We want to help our clients train smarter, not harder. So again, research showing that exercise lasting about 45 to 60 minutes at that moderate intensity, 50 to 70% VO2 max, or 5, 6, 7 on the RPE, rate of perceived exertion, is going to be the best to maximize our immune system. So for a quick review, right, we have our immune system, we have our white blood cell response to pathogens. Here with SpectraCell and the micronutrient test and the Immunodex, we're looking at the adaptive immune response, most specifically the T lymphocytes and that cell-mediated response to a foreign invader. And so this is where I had this slide. I thought it was on another slide. So I pulled this, right? These are our sports nutrition nutrients where, and normally doesn't work in this system, but I will overlap them with the immune system nutrients that I have in blue. But unfortunately, it doesn't work very nicely here. Anyways, with that said, though, again, just to reiterate, all these nutrients and how they are working synergistically to help maintain our immune system, to help support our energy levels, help keep us healthy in order to give us a good score on that Spectrox and Immunidex, which are the summary and bringing this test together as a whole. Okay, so that's all I have. I'm ready for questions.
Remember, you can submit your questions in the Q&A box on the left of your screen.
Yes. So can we share timing of antioxidant intake with workouts? Yeah. So there is, that's difficult. I would say based on some of the literature that we have now, I do kind of agree with taking the antioxidants away from the exercise activity. So if we're doing anything specific, maybe a full multivitamin around that time, from observational and working with athletes and having a controlled system, that seemed to work. But yeah, I would maybe wait and have it, take it at the opposite end of the day based on what I know right now with how they may or may not interact after exercise. Will the test vary depending on how the person is exercising at the time? Well, that's a great question. It depends, right? Because, well, not actually, it depends. Probably not. Well, okay, remember, let me start here. Remember, it's the T lymphocyte, right, that turns over every 5 months. So you're looking at 4 to 6 months back. So really you're looking at what was their exercise routine in that 4 to 6 month period. So I hope that answered the question. Did you say that dosing antioxidants that are not needed will cause more oxidative stress? Yes. Yes. So when we don't, that's why we like to test, not guess, because when we don't need these antioxidants, again, too much of a good thing, just like protein, too much protein can defeat the boosting of the immune system, or too little as well. Same thing with our antioxidants. Taking too much can turn into a pro-antioxidant. Is it important to take antioxidants before or after a workout? Did I answer that one already? Oh, similar, Cindy. Can you share timing? No, I haven't seen it before or after a workout, and I actually have seen more of, the vitamin C and the vitamin E might be detrimental, but then again, looking at the study design, and there's so many variables, it's kind of hard to say. So with the little that we have on research and whether they are, it is controversial on whether they are or not. I would just say if you know that someone's low in these nutrients, if they're low and taking it around training time, my assumption, and from what I know, in my opinion, no, it's probably not a bad thing, because that antioxidant is needed in order to drive that immune response, in order to help support recovery, in order to help support the protein and carbohydrate breakdown and utilization. So I think that's where I would say it depends. Are they deficient, and are we taking it around training time because we need compliance? We're probably okay. But again, that's my opinion, based on what I know right now. Can RDs order Immunidex and Spectrox? So it's all, great question, it's all one test. So the micronutrient test, you get all 31 analytes, vitamins, minerals, antioxidants. It all comes together. We don't do it separately. If you have a low glutamine, what would you supplement to bring up those levels? Yeah, so on the, what I found using SpectraCell is starting for a borderline, a good starting point is about 2 to 3 grams of L-glutamine daily. And if we see a functional deficiency or a red circle in the gray, we can go upwards of 5 to 8 grams of glutamine. Those are starting points. And then as we retest, right, we always want to retest in that 6 to 8 month period. The soonest, ideally, we can retest is 6 months, again, because the T lymphocyte, it turns over every 5 months. So that's a good starting point. And then we may have to titrate up or down depending on how we see that analyte moving or not moving. Well, as we're waiting, just in case anybody wants to throw in a last question, I do want to say that I have used this a lot. I like using it with my athletes because it's a great visual to show them, hey, we need to incorporate some recovery days, and or we need to get our nutrition a little bit more on point, more fueling times, more calories in, and it shows them where they're where they're faltering, and it has that great visual, which is helpful because it's hard with nutrition. There isn't, yes, we can go on feelings, how are you feeling, how are you sleeping, and sometimes that's enough, but sometimes they need a little bit of both, and the visual comes in really handy. Okay, we have a couple more that came in. Do you know how MitoQ might affect intracellular CoQ10? I do not. I do not, Susan. I can look into it, and we'll have Jessica get back with you. Would you recommend someone decrease exercise or training when you see it is affecting their immunity? How do you discuss that if they are athletes? Yes, I do. I would say we need to look at how are they. I'd look at periodization, right? What are they doing from a macro, micro, mesocycle type of schedule? So within that week, what are they doing? So within that day, within that week, within the month, within the quarters, within the year, how are they undulating? Are they having rest and recovery periods? Are they just constantly going at it? Like some of my athletes sometimes, because coaches will have really, really high training periods and sometimes a little bit too long. So again, having that talk with them and what they can control, what they're willing to do. Although I've had clients where they're still not going to rest and relax, right? They're on that runner's high and that hit high, and they just go, go, go. But yeah, I would really encourage working in yoga and walking and maybe swimming days, low rest, Pilates, lower intensity, low impact days, recovery days. Do you have any examples of patients that you can run through with us? Sure. I can't pull them up right now on my screen, but, I've worked with a couple teams. For instance, I've worked with baseball, I've worked with soccer, I've worked with football. So I've worked with a bunch of different types of athletes. And yeah, I would say even more so than our general population, their Spectrox and their Immunidex is always poor. And I will see a lot of low chromium, CoQ10, because as we know, major antioxidant of the heart, as well as the electron transport chain and that generating of ATP. I will also see that stress pattern a lot of the B12 and the pantothenic acid. So those are a lot of the patterns I typically see. I will also see that gut dysbiosis. I'll see a gut pattern with the athletes a lot as well. And then we work on what I'm allowed to dose them with in terms of a therapeutic repletion protocol. I will work with them on meal timing. I will work with them on overall total calories as well as in the breakdown between their macronutrients. And then we'll retest, again, if they let me, we will retest in that 6 to 8 month period and rinse and repeat.
Thank you, Danielle, and thank you all for attending. We are out of time for questions.
Thank you, everyone.